Hi, how are you doing today?
Good, how are you?
Good. My name's Casey. I'm a student nurse from Valencia College. I'm going to be working with you today. Before we get started, I just want to verify some information. Is that okay?
Mm-hmm.
Do you mind stating your full name and your date of birth for me, please?
Yeah, Jean Doe, January 23rd of 85.
Okay, and your medical record number matches what I have here. Do you have any known allergies to food, medication, drugs? No? Okay, and on a scale of 0 to 10, 0 being no pain, 10 being the worst pain you've ever felt, what would you rate your pain level right now?
A 2.
A 2? Where is it located at?
In my head.
Does it radiate anywhere else? What does it feel like? Is it throbby, achy?
Yeah, it's throbby like a headache.
Throbby? When did it start?
This morning, I think.
This morning. Would you like for me to call the physician to get any medication? No? Okay. Before we get started, I just want to let you know that I have an order to do a physical assessment. It's just to get a baseline status of your health as it is right now. Is that okay?
Mm-hmm.
Okay, do you know where you are?
Valencia Memorial Hospital.
Do you know what year it is?
2018.
And do you know the President of the United States?
Donald Trump.
Perfect. Okay, I'm just going to start by looking at your scalp. Do you have any difficulty hearing?
Mm-mm.
And do you have any difficulty smelling?
Mm-mm.
No? Do you mind sticking your tongue out? Smiling? Perfect. I'm just going to check your pupil size. Okay, and then I'm going to shine a light in your eye, so if you could just focus on my nose while I do that.
Mm-hmm.
Okay, and then just go ahead and focus on that spot on the back wall right there, and as I move this into your sight, just look at that.
Mm-hmm.
Okay. Now I'm going to move on to your pulses. I'm going to check your carotid pulse one at a time. +2. +2. I'm going to move down to your brachial. And then down to your radium. And both of those are +2. And as I'm moving down, your skin is dry and intact. Your bony promises are good. I'm going to check your capillary refill. And that's good. And your skin turgor. That's good. At this time, I would check the femoral pulse, but we're not going to be doing that for the sake of the video. Moving down, I'm going to check your palpate. +1. +1. Down to your posterior tibial. And then your dorsalis pedis. Okay. And as we're down here, I'm going to go ahead and check your strength. So if you could just press up for me. And then press down, 5 out of 5, and then pull back, and then go forward, 5 out of 5. Now I'm going to go ahead and check your strength of your upper body. Push against me, now pull, and now squeeze my fingers. Good, everything's 5 out of 5. Now I'm going to go ahead and listen to your heart. I'm going to be above your shirt. Start with your aortic, your pulmonic, your secondary pulmonic, your tricuspid, and then do you mind lifting for me? I'll do your mitral, and at this time I will listen to the apical pulse for 1 minute. Now I'm going to go ahead and listen to your lung sounds, so if you could just breathe regularly for me. And then just go ahead and put your hands on your hips like Superwoman. Okay, and you just face that wall. I'm going to go ahead and do your back. Okay, perfect. If you could just go ahead and lay down for me, I'm going to listen to your bowel sounds. When was the last time you had a bowel movement?
This morning.
This morning. And when was the last time you went pee or urinated?
2 hours ago.
2 hours ago. And then your last menstrual cycle?
2 weeks ago.
2 weeks ago. Is there any chance that you could be pregnant?
Mm-mm.
Upon inspection, I don't see any abdominal distension or discoloration. I'm going to go ahead and auscultate starting in your lower right quadrant.
Okay.
And if I didn't hear any bowel sounds, I could listen up to 5 minutes. Now I'm going to go ahead and palpate. Just let me know if you feel any tenderness. Everything good? Okay, perfect. That completes our physical assessment. On a scale of 0 to 10, 0 being no pain, 10 being the worst pain you've ever felt, what would you rate your pain right now?
A 0.
A 0? Do you have any questions for me?
Nope.
Okay, you have a call light right here and on the other side of your bed. I'll be back in about an hour, but if you need me before then, just hit that button and I'll come back.
Okay.
All right, and at this time, I would document and wash my hands.